Hello everybody, and thanks for joining us. I'm here with Dr. Jenna again today. We want to give you a brief update on the latest and greatest with some of the new health information that's coming out related to COVID-19. And right out of the gate, I'd just like to point out my beautiful pink mask. We all are doing our part to find creative ways to cover our face. And so I want to say thank you to all of you who are working hard to keep your fellow employees safe by wearing masks. The reason I'm not wearing a mask while we're talking is Dr. Jenna and I are actually sitting at an appropriate distance away. So again, as you become more comfortable with wearing masks here at work, we encourage you to read the policy that just came out for our phase 1 mask wearing and really just be mindful of your interaction with your fellow coworkers as we try to get through this time together, keeping each other healthy. So thanks, Dr. Jenna, for joining us today. So let's start with what we've learned over the last few weeks since this virus really broke in March.
I think one of the bigger things that happened actually just this week is that we have had the tincture of time so that we've started to see some of the less common or less typical symptoms that have come up with the novel coronavirus. So whereas before the symptoms that we would have suspicion and test for would be fever, cough, and shortness of breath. And those are the major symptoms. Well, just this week, the CDC came out with new guidance that added to the symptom definition for COVID-19, and they added a list of minor symptoms, and those include things like shaking chills, sore throat, fever, headache, and then loss of sense of smell or taste, which has been something that's been very popular in news cycles recently. So I'm sure the employees will not be too surprised to hear that that's been added as a criterion for symptom-based definition.
So here at Coors Tech, we're doing health screenings every day for all of our team members as they come to work. How are we going to incorporate those here at Coors Tech?
So the way that we're envisioning it is that we want to try and still make it simple. We don't want anyone to have to go through a convoluted set of symptoms and time frames. So we're going to make major criteria, and that's going to be 3. That'll be fever, cough, shortness of breath. If you have any one of those, we'd recommend that you stay home, or if you've come to work, that you go home. And then we'll have a smaller area of minor criteria. And what we're saying and what the CDC is saying is that if you have 2 or more of those, you should stay home or you should go home. And so we're going to try to make it separated so that it's easy to look at these symptoms and to do some self-monitoring and decide if you need to go home based on how you're feeling.
Okay, that's good to know. So here at Coors Tech, we're going to keep updating our health screening protocols to make sure they're in line with the CDC, making sure that first and foremost that we help all of our folks at home who are watching this know that if you're sick, please stay home. It continues to be our policy, and as these symptoms evolve, we will update our screening protocols to make sure that they match so that you can feel comfortable knowing that we as a company are taking your health continued very seriously. We continue to understand that the virus, it's 7 to 10 days of having symptoms. That's still holding true. We've learned that we can kill this virus easily. Can you talk a little bit about that?
Well, one thing that I really like to compare this to, and I took this from a virologist who, they make this their career's work, but basically comparing the novel coronavirus to things like norovirus, which are very surface stable, meaning that they can survive on surfaces in enough amount to make people sick just from touching a surface for several days. If you contrast that with the novel coronavirus, it's actually very easily susceptible to common household cleaning agents, so things like bleach, Lysol wipes, alcohol-based sanitizers will easily inactivate the novel coronavirus. And so I think that that's worth remembering and hopefully reinforcing cleaning and sanitary practices at home as one way to really make sure that we're keeping ourselves safe from contracting the virus.
Here at work, that's why we do all of these sanitary procedures on a regular basis, because it helps continue to mitigate the spread of the virus. There's been a lot of talk around therapeutics. What have we learned, and what should we be encouraged by this information?
Yeah, so yesterday actually there were 2 different trials that had data announced and publicized, and this was around remdesivir, which was an antiviral that was initially developed and used to treat Ebola. We know that remdesivir does act in vitro and in animal studies. It helps reduce virus from SARS-CoV-2. And so that was initially used as a compassionate use drug because we didn't have great patient data to support its use. Now we have 2 trials. The first one came out of China yesterday. it didn't show a time to clinical improvement, but then a second trial with a larger number of patients was published, and it was supported by the National Institute for Allergy and Infectious Diseases, NIAID. That's Anthony Fauci's institute. So that study actually showed that there was statistically significant time to clinical improvement. So that, just to sort of translate, that's a good sign. That's something, we needed some good news with this, and what we're finding is that remdesivir might actually speed up the time to improvement. It was given to patients with severe symptoms, and one thing that I would personally like to see is if remdesivir is given earlier in your course of illness, if that can somehow help with ICU admissions, help prevent some of the severe symptoms that we're seeing. So I think that there's a lot that remains to be seen with remdesivir, but we had a little bit of encouraging data that came out yesterday.
That's good. So as we continue to progress through this virus, the work that we do around social distancing, around wearing masks, keeping our hands clean, not touching our face, keeping the surfaces clean, are all non-pharmaceutical methods that we can take to help mitigate the spread of the virus. But at the same time, healthcare professionals are working diligently to try to find medical solutions to this as well. So that's
all the time. Yeah, it's been inspiring seeing it. I mean, we have more than 80 vaccine candidates that are being actively pursued, and so it's a global effort that is unlike anything we've seen before.
That's great. Well, thank you everybody for joining us. We hope this has been a helpful time spent with Dr. Jenna. Don't forget to wear your mask here at work and out and about in public, especially find those times when you're interacting with your teammates here. If you can't find that 6 feet of space to interact, go ahead and just pull that mask up on your face like this, and but most of all, please stay healthy and stay safe, and we appreciate all that you all are doing here at Coors Tech every day. So keep up the good work, and we'll be talking to you soon.